Hello, ladies and gentlemen. Hopefully, some of you have watched my discussion on Chapter 17. Now I'm going to talk about Chapter 18 that's titled The Circulatory System, Blood. Chapters 18, 19, and 20 all cover the circulatory system. This is the first of these three. Before you get into this, hopefully you have seen the list of important figures and tables that I would like you to have printed if at all possible. It's going to make my job here so much easier, and it will help you tremendously in the long run. Okay, now I hope that you have these copies in hand. Let's first discuss just some very, very general things. What are the functions of the circulatory system? Let's define the circulatory system. It consists of the heart, blood vessels, and blood. The cardiovascular system only refers to the heart and the blood vessels. There are many different functions of the circulatory system, as you will see outlined on page 673. I'm not going to go through all of these. There are about 12 or 14, but they all are lumped into three categories: transport, protection, and regulation. To look at now figure 18.1. These are formed elements of the blood, meaning cells or pieces of cells that you can see just in a plain light microscope. In general, adults have about 4 to 6 liters of blood, depending on how large we are. The matrix of this is the blood plasma. Suspended in this plasma are the formed elements. As I said, cells and cell fragments. We are going to spend most of this chapter discussing these formed elements. And they are erythrocytes, fancy name for red blood cells, platelets, leukocytes, which are in two subcategories, granulocytes and agranulocytes. These all together are called white blood cells. And if you look at that picture, this is what the cells look like when they are stained in the usual manner. Okay, erythrocytes make up the vast majority of these formed elements. They make up, this is a wide range, but your author says between 37 and 52% of the total volume. That number is called the hematocrit. After you have spun the blood down, there is a very thin layer between the plasma and the erythrocytes. This is called the buffy coat, and it is made up of leukocytes and platelets. Look at table 18.1, and this lists for you some very general properties of blood. And these are some good things for you to know also. Now, blood plasma makes up roughly 55% of the whole blood. It is almost colorless, maybe a little bit yellowish. It is a very complex mixture of water, soluble proteins, nutrients, electrolytes, nitrogenous wastes, hormones, and gases such as oxygen and carbon dioxide. If the blood clots and the solids are removed, then you are left with only the fluid called serum. There are many types of proteins, and I want you to know the most important ones. The most abundant and smallest protein in this plasma is albumin. It serves to transport various solutes, and it also helps buffer the pH of the blood. Globulins are divided into three subclasses. And if you know your Greek, these subclasses are alpha globulins, beta globulins, and gamma globulins. We will discuss those just a little bit more later. Another very important protein is fibrinogen. This is a soluble precursor of fibrin, which is an important sticky protein that when it is activated, it will help form a blood clot to stop bleeding. As I said, there are other things in the blood, such as nitrogenous wastes. These are toxic end products. The most abundant is urea. Plasma also transports other nutrients and electrolytes and gases. Please look, or please have printed out tables 18.2 and 18.3, both on page 676. These are some very important, the composition of the blood plasma and major proteins of the blood plasma. Two other definitions that I'd like you to know. One is viscosity. The viscosity of any fluid is its resistance to flow, and that results from the cohesion or the sticking together of the particles. Whole blood is about 5 times as viscous as water. And of course, that's because of the various proteins and other components in the blood. Osmolarity of blood is the total molarity of all of the dissolved particles that cannot pass through the blood vessel wall. And it is very important. We will discuss it also a little bit later. How and where is blood produced? We all should know that blood is lost continuously. Sometimes just due to old age of the cells, and sometimes it's lost from small amounts of bleeding. Here's some important, or I'd say surprising statistics. Every day, an adult typically produces 400 billion, with a B, platelets, 200 billion, with a B, red blood cells, and 10 billion white blood cells. All of this together, all of this production together is called hemopoiesis. The tissues that all produce these blood cells are called hemopoietic tissues. Once we are born and past our first few weeks or months, almost all of the blood components are produced in the red bone marrow. White lymphocytes, which make up a portion of the white blood cells, are also produced in some lymphatic tissues and other organs. Section 18.2 talks about erythrocytes, or red blood cells. These have two principal functions. One is to pick up oxygen when the blood flows through the lungs, and then to deliver it to tissues everywhere else in the body. The second function is to pick up the waste product, carbon dioxide, from tissues and then bring it back to the lungs so that it can be removed. Erythrocytes have a very easily identifiable and specific shape. Look at figure 18.4. At the very top, you will see that erythrocytes have what is called a biconcave shape. They have a thickened rim around the cell and then a sunken center. Also important is that these red blood cells do not have any nucleus or other organelles. They are packed full of a protein called hemoglobin. This is a very complex group of fibers of protein shown in figure 18.5. This hemoglobin is able to bind oxygen and then also to bind carbon dioxide. It also has in the very center, if you look very carefully at figure B in that part, in 18.5, you will see one iron element in the very center. This iron is absolutely essential to the function of the red blood cells. We have a huge number of erythrocytes in the body. The red blood cell count in an adult is usually between 4.5 to 6.5 million red blood cells per microliter of blood. Women have a slightly lower count. A microliter is a very, very small amount of blood. The red blood cell count, as I said, is usually larger in men, and that is primarily because of hormone differences in our sexes. Women of reproductive age have periodic losses of blood in their menses, and the hematocrit is inversely proportional to the percentage body fat, which is a bit higher in women. Figure 18.6 at the bottom of page 680 shows the steps or stages in the formation of a mature red blood cell from a hemopoietic stem cell that you would find in the red bone marrow. As I said, iron is very essential. Later we'll talk just a little bit about what is called anemia. This occurs if the amount of red blood cells in the body or the amount of hemoglobin is smaller than normal. One of the most common types of anemia is iron deficiency anemia. This can occur when, got a cat sitting right in the middle of things here. You get down, please. I guess I haven't told all you all. I told the group of students in Biology 250 that I'm teaching that my wife and I love cats, and we have rescued quite a few from the humane shelter. We have a large home with only 3 of us living here out in the woods. So we have a lot of room for cats. And there's no place in the world, I don't think, that has more love in this house than ours does here because of these cats. Okay, I mentioned that erythrocytes have a very short life, or if I didn't, I'm going to say that now. They usually only survive about 4 months, roughly 120 days. Then they are broken down. The iron, the hemoglobin, is retrieved and used again. One of the wonderful types of, I'm not worried about some of these cats and what they're going to knock off the table there. One of the primary examples of recycling that can occur. There are two major erythrocyte disorders. One is called polycythemia, and this is when there are too many red blood cells. There are only two major causes. One is a cancer in the bone marrow of this erythropoietic line of cells. Polycythemia can also occur, what is called secondary polycythemia. It can occur if the person is extremely dehydrated, or by smoking, air pollution, emphysema, living for a long time at high altitude. The principal dangers of polycythemia are this increased blood volume because of the cells, higher than normal pressure, and a higher than normal viscosity of the blood. It can cause hardships to the heart and difficulties there. Just very briefly, some different kinds of anemia. You can see these listed in table 18.4. Because this is the second in our series of 2 courses in normal anatomy and physiology, we don't spend a lot of time discussing abnormalities of this anemia or physiology, but here is one example. Different types of anemia. In the table, it lists 3 primary categories. One is an inadequate production of red blood cells, most commonly due to an inadequate supply of iron. There is blood loss due to trauma or hemophilia, menstruation, other things that would result in blood loss. And then there is excessive red blood cell destruction. These can occur from drug reactions, poisoning, some hereditary defects such as sickle cell disease and thalassemia. Sickle cell disease is discussed, and there are some pictures of what cells look like when they have taken on this sickle form. That's all on page 684. Both sickle cell disease and thalassemia are hereditary and occur almost exclusively in people of African and Mediterranean descent. Sickle cell disease afflicts about 1.3% of people of African American descent, and this can be dreadfully serious and even lead to death. You can read more about that on your own. Section 18.3 talks about blood types. Blood types and transfusion compatibility are a matter of interactions between plasma proteins in the bloodstream and the erythrocytes. These blood types are based on large molecules called antigens and antibodies. The antigens are very complex molecules that are unique to each individual. They are bound to the surfaces of all cells and enable it to recognize the body's own cells. Antibodies are found in the serum or of the blood and can result in agglutination or clotting of the blood if there is an antigen-antibody complex formed. You will have a lab later where you will do some of this. Look on page 686, table 18.5. These are the 4 ABO blood types with the relative percentages excuse me, in American population. No, this does not have anything in it about RH. We'll talk about that in a moment. For example, type A blood has an A antigen in the attached to the surface of the red blood cell. It has an antibody to type B blood in the plasma. Just reverse for type B blood. Type O blood has no antigens, but it has antibodies to both type A and type B. If you've ever watched a TV show where they're in an emergency room, they try their best in these hospitals to have a large supply of ORH negative blood, because this is called the universal donor. It will not cause any harmful effects with anyone else's blood. O negative. Okay, on page 688, you will read a short discussion of the RH blood group. This was named for the rhesus monkey found in Africa, where RH antigens were first discovered back in the 1940s. There are several subtypes of antigens, C, D, and E. These make up or form what is called the RH factor. This can also cause serious clotting or agglutination problems if RH positive and RH negative blood comes together. The three pictures of a woman in the bottom on page 1816 show what can happen to result in hemolytic disease of the newborn. Very, very fortunately now, we have a very excellent immunization, if you will, that is given to an RH negative mother in the hospital if she delivers an RH positive baby. This will confuse her immune system. She will not develop any anti-D antibodies, and any subsequent pregnancies then are also safe. Section 18.4 Page 690 starts a discussion of leukocytes. These are called white blood cells. Figure 18.17 shows a representative black and white picture of a white blood cell. This happens to be an example of an eosinophil that's discussed here in a bit. Leukocytes make up about 5 to 10,000 white blood cells per microliter of blood. This is a small number compared to erythrocytes, but they are extremely important. When you read through the next 2 pages, you will read about the 5 different kinds of leukocytes. There are 3 what are called granulocytes. And these are called granulocytes because when they are stained in a laboratory, you can see various types and colors of very specific granules in the cell. Neutrophils are the most abundant of white blood cells. They are sometimes called polymorphonuclear leukocytes because they have a very unusual multi-lobed nucleus. These are very important in combating bacterial infections. The other 2 types of granulocytes are eosinophils and basophils. These are very rare if you look at a blood film under a simple light microscope because there are so few of them. But I want you to read through there and pick out a couple of important things to remember about eosinophils and basophils. There are 2 types, subcategories of agranulocytes. These agranulocytes lack these specific granules in the cytoplasm. The largest by far number of agranulocytes are lymphocytes. They are much smaller than other leukocytes and are very prominent when you see them under a microscope. Another type, or the second type, are called monocytes. These are extremely large. There aren't very many in a blood stain, but they become very important because they transform into another cell type that's called a macrophage. And this is a phagocytic cell that destroys dead or dying host and foreign cells and can help get rid of them out of the body. Table 18.6 is an excellent source of information for you about the 6 types of white blood cells. This table takes up 2 pages, and as I have said and will say, I hope that you have the capability of printing off these pages. Excuse me. The leukocyte life history. Now, first we want to talk about leukopoiesis. That is the production of white blood cells. You will see that in figure 18.18 on page 695. Just like erythropoiesis, leukopoiesis starts with the very same hemopoietic stem cell in the bone marrow. But because of DNA, it can form into these 5 different types of leukocytes as well as the erythrocytes. There is a very short discussion about leukemia or leukocytosis. Leukocytosis occurs when there is infection, and you would see in a white blood cell count rather than the normal of 5 to 10,000, it might raise up to 15 or even 18 or 20,000 if there is a severe infection. Leukemia is a cancer of the hemopoietic tissue, and that can result in a huge number of circulating leukocytes as well as their precursors. This can cause severe disease and even death. Much progress has been made in treating various types of leukemia, but some still result in blood. Section 18.5 talks about platelets and hemostasis. Hemostasis is the control of bleeding. Platelets are not cells. Platelets are small fragments that have broken off of a cell in the bone marrow called a megakaryocyte. Despite their very small size and the fact that they're not really cells, they have a huge number of functions that are listed on page 697. Just remember to associate platelets with blood clotting, hemostasis. Look carefully at figure 18.21 at the top of page 698. These are three mechanisms that occur that can help stop bleeding. First is vascular spasm. If a blood vessel, either an artery or a vein, is completely cut transversely across, the blood vessel can constrict and stop a lot of the blood from flowing out. Part B shows a platelet plug forming. The platelets combine with fibers of collagen, which is a type of protein, and this forms it forms a plug. This plug then, after what is called coagulation, forms a blood clot. This blood clot, if it is protected with a bandage, for example, will remain in place until the tissue can be healed. There are two different types of coagulation. One, if you look now at figure 18.22, you will see to the left what is called extrinsic mechanism. To the right is called intrinsic mechanism. The extrinsic mechanism is initiated by clotting factors that are released if the damaged blood vessel and perivascular tissues contact air. The intrinsic mechanism occurs inside the body and is a very complex series of stages that result then finally in the coagulation of blood. Okay, I believe that that is all. You might want to look at figure 18.25 on page 704. It's called clinical application. Sometimes little creatures called leeches are still used to help remove, in medical science, they are used to remove clotted blood after a hematoma forms under the skin. They actually make a painless bite and can suck out the blood clot. In my many years of working in emergency rooms, I never had the occasion to use any leeches, and I didn't ever ask if there were any present there. Okay, this is the end of chapter 18. I hope you learn something and get something from these videos. You will find all of them in YouTube. Thank you very much.